Advocate Illinois Masonic's Anesthesiology Residency Program is one of Chicago's oldest residency programs, recognized for its comprehensive and excellent medical care. Illinois Masonic is located to the north of the city in one of Chicago's most vibrant neighborhoods, Lakeview. The anesthesiology department offers our residents and patients the best in anesthesia and medical services. Our residency program creates an optimal learning environment given its wonderful location and diverse patient population. Our residency program is one of the oldest in the city and one of the best. We offer an excellent residency program encompassing all areas and subspecialties of anesthesiology.
We're a Level 1 trauma center, the only Level 1 trauma center in the northern Chicago area. As a result, we see a variety of clinical cases and work closely with our emergency department, trauma, and surgical ICU teams as early as intern year. We are privileged to train at a residency program that prioritizes autonomy as well as supervision. Attendings in our program are motivated to teach and support residents in and outside of the OR. As anesthesiology residents, we have access to spacious, state-of-the-art ORs equipped with anesthesia machines and a workroom for all supplies. We have a great relationship with the CRNAs and anesthesia techs who help us manage day-to-day workflow without any hiccups. Our busy operating rooms include pediatrics, cardiovascular, neurosurgical, OBGYN, as well as general and orthopedic ORs. Airway equipment, this is our main general setup, where we have new ventilators, computers, and a Pyxis in each operating room where we can work on our daily stuff. We offer excellent training in critical care and pain management, as well as regional anesthesiology. Residency education is further enhanced with our affiliation with our sister hospital, Advocate Christ Medical Center, as well as Lurie Children's Hospital of Chicago, two premier medical centers in the Midwest. We also have dedicated surgical ICUs, as well as medical ICUs where residents participate in taking care of critical patients requiring resuscitation and interventions.
One of the biggest advantages of our program is our chronic pain clinic. The chronic pain service has been a huge part of the framework of our residency program. Residents have the opportunity to learn from accomplished pain faculty, perform novel fluoroscopic guided procedures, and publish in high-impact journals. Residents from our program are exposed to chronic pain as early as their intern year and learn cutting-edge pain treatment modalities. We have a dedicated pain research team that compiles data and guides residents in academic writing for publications.
And so it's been an honor and a privilege to be the program director at Advocate Illinois Masonic. I think, as I said, it's a wonderful program, a program full of tradition. It's one of the oldest programs in the city and always has excelled on so many levels. I think the scholarly work production of this program is unparalleled. Our residents always do amazing job, not only at the MARC meeting, the Midwest Anesthesia Resident Conference, but also at the local Jeopardy tournament, you know, what they do between different programs, and we won it this year.
Every day we have structured morning lectures that cover case-based discussions, keywords, journal clubs, and M&M cases. These are held in person and online. Our program's commitment towards residency training is further exemplified in the variety of teaching resources we have at our disposal. The program has a well-rounded didactic curriculum with the goal of preparing residents for not only the American Board of Anesthesiology examinations, but also practical tips on becoming an excellent anesthesiologist who can thrive in any situation. We have our very own simulation lab where faculty members lead workshops on line placements, airway management, and critical resuscitation.
What I find unique about the program is honestly diversity of patient population that we have here in Chicago. And being in Lakeview, we get to see so many different demographics and also in a more relaxed setting. I feel like our program has a great value in being a more laid-back type of hospital in which we don't always have to be in full panic mode, but we do get certain situations where we have to really think and be quick on our feet.
And to add on to the research aspect, I think that really helps us get awesome fellowships afterwards. Pretty much everyone out of here who wants to go into competitive specialties can do so. We have people going to Mount Sinai in cardiac, we have people going to Boston Children's for pediatrics. Pretty much everyone who applies into a fellowship gets their top fellowship choice.
As long as of Chicago, it's my favorite city ever. There's a lot of things to do outside of work, from restaurants to concerts to just going to relax in the lake. The location of the hospital is almost like 10 minutes away from downtown, which allows us to go there if we want to very easily, or just stay in the outside and doing things a little more relaxed, which I think everyone that comes here is gonna find something to do.
I do have to say one more thing. For me, one of the things that struck me the most about this hospital is on my very first day of interviews, when I entered the hospital and I was greeted by a big rainbow flag. And to me, that spoke volume of the inclusion that this hospital really has and wants to maintain. And that's the philosophy that I'm also bringing into the program. It's already existed, but we want to make sure that we continue to expand that, because everybody's going to be welcome here and everybody's going to be valued and everybody's going to be celebrated.
Please reach out to us if you have any additional questions about the program and living in Chicago. We are excited to meet you.